but it's not. And with that in mind, we're bringing in the major candidates for mayor, talking to them about the issues that matter to Torontonians. We started off talking about how we get around in our city, gridlock and transit. This morning, we kicked off a series talking about how we pay for the things we need in our city. And the first candidate to join us this morning was George Smitherman. When you look at the city's finances, what's the first word that comes to mind?
I think that it is not crisis. In the lead-in to your piece, the word crisis comes up. I think that the City of Toronto is going to go into 2011 with a modest surplus, something that other levels of government would love to see. I think prudence, restraint, I think that these are words that first come to mind.
And yet we're always seeming to have to cobble together money to balance the budget. There's this mad scramble. Will we be bailed out? Will we find $100 million at the back of the couch that we seemed to last year?
I think
that suggests a crisis, doesn't it?
I think this is a crisis of leadership. I actually think this is one of the things that motivates me to run. For sure, Torontonians feel nickeled and dimed to death, and over the last 7 years, the range of resources that the city government has grown a lot, from gas taxes from the federal and provincial level, City of Toronto Act, which allowed for things like the vehicle registration tax and for the land transfer tax. City of Toronto's revenues are more diverse and in relatively better shape than they were. It will always be a big challenge to have the resources that you require. But I think that job one for me as a mayor working with City Council is to restore a sense of pride in our city, in part by giving way and getting away from this annual storyline where Toronto projects itself as broke and bankrupt and powerless. I think it is within Toronto's power to have a balanced budget, but restraint will be necessary to achieve that.
You have a plan called Service First. It looks at a review and an improvement of how, I guess, the city would provide core services.
What I find in talking to people is that they've paid more, but they don't feel like they're getting more for it. And there's a lot of frustration, whether it's the implementation of garbage services. People are really frustrated with the cleanliness of the streets and the cleanliness of the TTC. And Services First is also a principle that says if we're going to, as a city government, look at outsourcing or privatization, then first and foremost, we've got to be clear on what it is that we expect in terms of the quality of that service. So I think job one for a mayor of Toronto is to restore pride in our city, and a big part of that is to create a stronger sense of fiscal credibility.
But you have a finite pool of resources there, and you have a city that's growing and a city that's population is expanding that demands more. So do you cut back on things that the city provides?
Well, the thing about it is that growth ought to be paying some of the way forward, that as you have new condominium towers, you have increases in assessment growth and such. So we shouldn't pretend that even though we have more people that they don't produce a greater degree of revenue.
But what about pulling back from services? What about cutting things that we're already paying for?
I think that we certainly have to clamp down on waste, and there's been lots of examples where there are opportunities to do that. And I think it will be necessary for the City of Toronto to look at some specific asset sales. I won't sell Toronto Hydro, but I think that there are other things that we can look at. Land bank, as an example. We have a lot of additional land. And I think that we're going to have to take a hard look at the bureaucracy that we have at City Hall and see if there aren't ways to thin the costs out associated with that. There's been extraordinary growth in the number of employees in Toronto, in the City of Toronto.
You haven't used the word services, though. So does that suggest that you don't cut any services at all, that you can find the money within waste, that you can find the money within those specific asset sales to pay for what we still pay for and perhaps increase that?
I'm strongly dedicated to a services first approach, which is designed to try and make our streets safer and cleaner, to get traffic moving more effectively, and to create a culture at City Hall where we're doing a better job of creating Toronto as a place where entrepreneurs can flourish. And I think that service reductions are something that we should seek as a last resort. But I really do think that we're into a time of restraint with respect to public sector employees. I've said if I'm elected as mayor, I will flatline my salary for the full 4 years of office. And I think this kind of leadership from the politicians is necessary. It's clear that senior levels of government, which have often been depended upon to drop that bit of dough into the hands of Torontonians every year to solve this budgetary crisis, that is not going to be an option in this in the circumstances that we're in the next 4 years, it's up to Toronto to, I think, take control of its own destiny.
The charge that some of your opponents present is that you shouldn't be trusted with our finances, that under your reign as the health minister, eHealth spent $1 billion, didn't seem to go anywhere. There are now questions about the local health integration networks, that George Smitherman simply isn't a guy that should be in control of my money.
Well, 2 points on that. First and foremost is that under my reign as Minister of Health, there was nowhere near $1 billion spent on electronic health. That was a report on 10 years of spending related to electronic health. I was a minister for 5 of those years. I have to take responsibility that the results weren't as good as people expected. I take responsibility for that. But in the same time frame, to be fair, if anyone wishes to do a little investigative journalism, I reduced Ontario's drug budget cost by $600 million a year, which has repeated many years now. Hospitals, when I was first as the Minister of Health, expected an 8 or 9% increases each year. I reduced that to 3% a year. That's a $14 billion base budget. So my record as the Minister of Health, the largest government department in all of Canada, is a record that bears, I think, taking a look at it beyond this one line about electronic health. On local health integration networks, I gather this is a story in the paper today. Yeah. There's a very bitter and partisan comment from Peter Kormos from the Niagara region. I'll say this about local health integration networks. When I first became Minister of Health, the ministry had more than 8,000 employees. When I left, it had about 4,000. That's because we eliminated ministry regional offices. We eliminated district health councils. Right. We shrank the number of community care access centers, and local health integration networks in no way have contributed to a burgeoning bureaucracy. In fact, they reduced the number of employees working in those areas, but they make hard decisions. And when you're making hard decisions about health care in the front line, it's very easy to criticize you. Right. But overall, that initiative has saved Ontarians, I'm sure, tens and tens of millions of dollars and brought the conversation about health care much closer to the people than it has ever been in our history.
That's George Smitherman with his thoughts on paying for it in Toronto.